in general medicine. So today's topic of the discussion is about, I'll be discussing upon the anxiety neurosis. So this can come as a short note in the professional exams where you are supposed to write about in a very short, in a brief, just that what do you mean by anxiety, and the complete term is anxiety neurosis. So students and viewers beginning with, so in this video we'll be mainly discussing about what is this anxiety and what this anxiety neurosis terms actually means. So the word, it says, for the term anxiety neurosis, it was given by Sigmund Freud in the year 1895. So students, the first point what you need to write in the exam, that the term anxiety neurosis was given by Sigmund Freud in the year 1895, and it can be defined as that it is an extreme form of anxiety. So the condition of anxiety is such a term what is used to define that there is certain kind of an uneasiness or tension or a fear of a particular thing that might happen. So anxiety comes when a student can be anxious about the his board's exams, or a student can be worried about the professional exams, how the exams will be there, how the result can be there. So anxiety is something what makes a person very much anxious. So students and viewers, so this is the technical meaning of anxiety. And when it comes to neurosis, so neurosis is a mental disorder that leads to obsessive thoughts and behavior. So you must have seen certain people that obsessiveness or compulsiveness, it becomes such a condition where the person has an irresistible urge to do something. So such a condition, it is called as irresistible compulsiveness. So compulsiveness is such a condition in which a person has an irresistible, uncontrollable urge to do something. So it is mostly said that in this anxiety neurosis, it is an extreme form of anxiety or worry compelling to feel intensely worried. So such a feeling makes the person intensely worried as to over a situation which can be really, it can be present in the real situation, or the person can imagine in the future that if this thing goes wrong, then what will happen, that thing can go wrong, then what will happen. So either the person is anxious about a particular situation what is really manifesting in the present environment, or the person can think in such a negative way that every situation in the upcoming future he assumes it to be in a negative manner, and he thinks the negative consequences, and such thoughts makes the person anxious. So it is an extreme form of anxiety or worry compelling a person to feel intensely worried. Whereas what is the meaning of the word neurosis? So neurosis, it is a mental disorder leading to obsessive thoughts and behavior. So that person who is having such a worrisome behavior, he is going to have certain obsessive and compulsive thoughts, and the thoughts will come in sequence one by one, that will be proceeding by thought, the other thought, and the next thought. The person will be all having a negative thoughts in his mind, just worrying about a particular situation which is might happen in the upcoming future. So such an intensely, the person is actually intensely worried about that situation, and it is a mental disorder leading to obsessive thoughts and behavior. So it is a mixture of anxiety, worry, stress, distress. The person can be even in a sad state. So it is a mixture of anxiety, worry, stress, distress, apprehension. The person has certain fears built in his heart. Fear, phobia of a particular thing. Anticipation, the person is expecting that something can happen in the near future, and that too in a negative way. Apart from this, there is uneasiness in the mind. There the person is un, unrest is there. The person becomes restlessness and compulsiveness. And in order to ward off that worry, in order to prevent that worriness, the person is going to repeatedly perform certain actions in order to ward off that feeling of negativity. So actually, when anxiety becomes so intense, it compels one to think or behave in a certain way. So there are certain persons, you must have seen that just because they are worried, so that makes them, that obsessiveness, that compulsiveness makes them behave in one particular way repeatedly. So they keep on doing a particular thing in that way. Some people are very much obsessed about punctuality. Some people, if they walk around the road, they'll keep on counting the bricks by the side of the road. So actually, this kind of a feeling, some people are so much hygiene conscious that they'll keep washing their hands continuously. So that in order to get that they might get disease, so they'll keep wearing double mask or triple mask. If they are exposed to certain kind of a dirty thing or any kind of dust they are exposed to, they will wash their hands twice or thrice. If they have locked the doors, they will going to check the door twice and thrice. So even if they, after locking the door, they have checked the keys, and once they have locked that confidently, they might keep on imagining that some theft might can happen, or if the parents are there, they might even think that whether their children are safe or not. So such feelings, such negative worrisome feelings will keep on, and in order to ward off that feeling, they'll try to do a particular thing in a very compulsive and a repeated manner. So, when anxiety becomes so intense that it compels one to think or behave in a certain way, it is called anxiety neurosis. And this anxiety neurosis is associated with symptoms such as palpitation. So, the persons who are suffering from this anxiety neurosis, they have certain kind of symptoms what can be manifested in the form of the patients, they become aware of their heartbeat, so they can have the feeling of palpitation. They can even feel a kind of a pain, that is heart pain. They might feel that they are having heart pain as well. They have constriction of throat, so their throats or throat, just because of the worriness, just because of the uneasy in mind and restlessness, they also might feel that there is constriction of the throat. Dyspepsia, so dyspepsia, it is the condition of indigestion. So just because of their worrisome habit, they might even feel that indigestion problems they can have, and they also feel that there is a bend-like pressure above the head, or cold, sweaty, tremulous extremities. So their extremities, the distal parts of their hands and feet, just because of their worried behavior, just because they are so much anxious, so that leads to the trembling and shaking of their hands, and the extremities becomes very cold and clammy. So such are the symptoms what are seen in the patients of anxiety neurosis. So this anxiety neurosis, it is a neurosis, it is marked by excessive tension or apprehension that is not restricted to a situation or objects. So unlike if it is a normal feeling in a normal situation, if something is provoking anxiety, so that is a real thing, that normal anxiety occurring in genuinely threatening situation. So there are certain things in our life what we see we actually face. So if it is a genuinely threatening situation, the person might feel anxious, but in the condition of neurosis, the person will feel that threatening situation, the person will imagine such a threatening situation which is not present in the real scenario. So when we look at the treatment methods, so firstly, such anxiety patients, they need explanation, they need to be counseled well, they need to be explained, and a proper reassurance will be given, should be given to them, that everything will be fine and nothing wrong is going to happen with them. So explanation needs to be given to them, the reassurance that they should be counseled, that everything will be fine and nothing wrong will be going to happen, is going to happen to them, and they should be given proper encouragement. If they are having constantly negative feelings, so they should be constantly encouraged to think in a positive manner. Alright, apart from this, if the patients of the symptoms of cold, sweaty hands and trembling extremities are there, so intravenous saline can be given. And lastly, but not the least, the most important drug of choice for anti-anxiety drugs such as diazepam is given to such patients. So this, students and viewers, this was a very short discussion where I've tried my level best to give you in English, in simple terms, that what do you mean by anxiety neurosis and what are the symptoms associated to it, how the patient feels in the condition of anxiety neurosis. Students and viewers, if you still have any queries or comments, if there are certain topics what you want me to discuss for you in English as well as in Hindi, you are most welcome to comment me in the comment section. And students, if you are new to my channel, you haven't subscribed, subscribe. If you like this video, give this video a thumbs up. And students, if you haven't pressed the bell icon, and for my upcoming videos you want the notifications, do not forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.